For the last couple of weeks, Maria Chaco says her 5-year-old son Jacob's had a bad cough he just can't kick. But when it comes to giving him any kind of cough or cold medicine, it's something she's always shied away from.
I've always had a gut feeling. Anything that I'm not sure about, I always ask the doctor to make sure that it's okay.
Chaco's pediatrician, Dr. Jamie Wells, says she was right to go with her gut, especially now that some drug manufacturers have already voluntarily pulled children's cough and cold medicines off store shelves, and federal advisors have deemed them unsafe for children under age 6.
You can ask any one of my patients. I've never endorsed any of these products. First and foremost, just because something's over the counter does not mean it's been proven to be safe, and cough and cold suppressants don't stop coughs. So if they don't stop coughs and can do potential harm, to me it's no-brainer.
Wells says when it comes to treating colds, there are lots of alternatives for parents. Number 1, if your child is coughing or congested, call your doctor. You want to make sure all they have is the common cold and not something worse. If you want to reduce a fever or pain, try acetaminophen, the active ingredient in Tylenol. You can also try steaming up the bathroom, particularly before bedtime. It can help drain congestion. And also plenty of fluids. Wells says, believe it or not, chicken soup really is good for the soul.
There is a medicinal effect to chicken soup. In chicken broth, there's something that spurs neutrophil production, and neutrophils are your first immune defense response. So actually there is something that came from the myth of chicken soup being a medicine in terms of that.
Another tip for parents, be patient. Eventually, viral infections do go away. Wells says if symptoms continue to last beyond 2 weeks, then it's time to see your doctor again.
Colds are a fact of life in terms of having a young child. The average toddler, especially ones in daycare, gets 6 to 10 colds per winter. If it's the common cold, then a child can cough for up to 2 weeks from the common cold, and that's a protective response. It's nature's way of preventing a worsening pneumonia.
And given that fact, while it's probably not easy to hear, instead of heading for the drugstore, that's why doctors say time really is the best medicine. In Manhattan, Cafe Drexel, New York 1.